Okay, so let's go ahead and get started. Welcome, everybody. Thanks for joining. We may get a few more people joining here in a minute. Just a few updates. As I just mentioned, there's a link in chat where you can see the recording of past meetings if you've missed any of them. Our next meeting will be on February 24th. That's a Friday again. Same time. That'll always be from 1:30 to 2 o'clock. And in the next meeting, we're going to have Aubrey Parks from the Wasatch School District present, along with Shelley Cooper with Intermountain Healthcare. And they'll be talking about how they've partnered with Intermountain Healthcare for backup nursing services, as well as access to licensed medical providers through the Intermountain Connect Care platform. So we're really excited to hear how things are going in Wasatch, and that should be a great meeting. As always, if there's any training needs, please shoot any of us an email, me or Brian or Nikki, anyone on our team. Brian was actually just down in Garfield School District today doing some training for secretaries at schools as well as school nurses. So please let us know if you have any training needs. We're happy to come visit and do some training. And so today we've asked Peggy Drussel, who's the school nurse in the Tinic School District. You probably all know Peggy, to give us an update on how she's using the telehealth kits for hearing screenings in some of her rural distant schools. So Peggy, thanks for coming. This is a really exciting project and a way to use telehealth to increase access to care and helping these students get the services they need. So I'll turn it over to you, Peggy.
Okay, well, you know, they've been able to install the hearing app on our telehealth boxes. And we've had the opportunity at Tinic to use that. With the weather the way that it's been, and we have a school clear out in the middle of the desert that's probably 180 to 200 miles away. And 90% of that is dirt road getting out there. So it's tough to get out there sometimes. And what we're finding in that school in particular is an increase in special needs kids. And those kids need to be screened quickly so that we know if they have vision and hearing problems, so we can refer them appropriately. That happened to us not very long ago, where we had two new children move in with their grandparents out in Trout Creek. And the special ed teacher needed them screened right away. So what we did was we used our telehealth box and the Pure Tone hearing screening on that telehealth box to screen those two kids. And we walked through a practice with them so they could see how it worked. One of them was a first grader, the other was a third grader. And so we walked through a practice with them, you know, about when to push the button and when to say they couldn't hear anymore. And the first thing we had to do was pair up our headphones. We have some nice headphones that lock out sound, and the screener on.
So you've already got it. All righty.
The screener on telehealth tells you if there's too much background noise. So then you can adjust the environment. You can adjust the headphones. You can shut doors. You can take them to a quiet area where you know you're getting an accurate screening. So it's very sensitive in picking up background, which is super important. You want the kids to get an accurate screening. So with the help of the secretary out there, we connected using telehealth and screened two kids in hearing, these two special need kids. And it was extremely successful. I could talk to them while they were screening and tell them, you know, what I needed, whatever I needed to tell them, give them instructions in the beginning, and I could watch because you can see when they push the button from your end when they're connected, and you can see when they push it and when they can't hear it anymore because they cannot hear. And then it goes down to the next level and will go up. And so by the end, you have a graph of where they're hearing. And so you know if it's accurate or if they're hearing at an accurate level. And so I was able to print off those hearing graphs and present them to the SPED teacher to show that both of these children had good hearing. Both of their hearing was really good. The vision screening, I also had to train the secretary on out there. And I watched using the telehealth box while she screened these kids. And we set up, she got the training online. She got the certificate, and then we set up the environment so I could watch using telehealth to see how these kids' vision was. And so within 3 weeks of these kids arriving at our school, we had them screened. If they would have had to wait till I could get out there, it would have been difficult because we've had so much snow. The roads have been so bad. Not only that, if a teacher suspects that a child has a hearing or vision change, you can evaluate that using your telehealth box. And not have to, I don't have to drive 200 miles to go out and see what might be going on with a child. I can also have them evaluate the inside of the ear to see if we've got a lot of cerumen buildup or an ear infection, or if something else is going on. And so my secretary out there has been crucial in helping me look at those things for those kids out there. We use it the most at that distance school, but I am using it for hearing screenings in high school kids that I'm having to rescreen because they did not pass the first time. So I'm rechecking them. And I'm also, again, looking in their ears for problems. Are there any, can I see a broken eardrum? Can I see any signs of tubes being in their ear at some point? Can I see redness? Can I see swelling? What is going on inside that ear? So I can appropriately refer them to a physician to have their hearing evaluated or their ears checked. So, so it's been extremely useful. I get so much better picture using my telehealth to look in those ears than, just using an otoscope. I get so much better picture of what's going on in that ear. So that's how I'm using the telehealth box. And it's been a super great tool, especially for schools that you just can't get up and walk into or travel 5 minutes and go to. So we had telehealth come out and give us a training, and we had our administrative assistants from all of our schools come. We had one administrator come from each school. So we're all really familiar in how that box works and how we can use it. So I think we've been very successful with it. It's been an absolutely amazing tool.
That's really great to hear, Peggy. Does anyone have any questions for Peggy?
Can I ask a question, Matt?
Yeah, go ahead. Hi, Macias.
Hey guys, yeah, Missy, I'm with the 19 Labs team. That we provided the boxes, or like the cases with the tablet and devices. But excellent use case, Peggy. Thank you for sharing. I have a question. It is, that we have a feature that can kind of do a screen capture, right, while we're doing some screen sharing. And I'm asking you this because you mentioned the graph on the hearing test, right? So it is, like having the graph is something that you need to, or it will be useful to get as part of the, like a summary for this encounter or something like that. So I'm not sure if you're were able to get the graph yourself, being remote to, put it on the patient or the student record, and if this is something that will be useful for you to have in the future.
Yes, it would be useful. I think it's useful for more than just me. It's also useful for these special ed teachers or teachers with kids with hearing problems to kind of justify why you're asking, them to be placed in the front of the room or on the left side of the room or on the right side of the room, or, it really is evidence to show that, yes, this child has a hearing problem, or no, this child has normal hearing.
Great. Okay, thank you. Yeah, because we, again, always thinking on ways to improve the experience and having access to, or streamline access for you all to get this graph after the exam is done is something that we need to look into. But yeah, thank you.
Thank you.
So Peggy, how did you get the printouted chart? Did the secretary at the school send it to you?
Yes.
Okay.
Yes, and she's been super helpful as far as getting it into the records and stuff. She knows that system inside out. We use Infinite Campus, and she's kind of our district coordinator for that program. And so she's able to teach me a lot about, this is how you can download a record there. This is how you can put this there. So she's been extremely useful for that. And that's our administrative assistant out to the West Desert.
Okay. So just so that everybody knows, the hearing app is not on all of the tablets, but we can put it on for free. There's no cost to having the hearing app. Just let us know if that's something that you need. We can give you the instructions how to download the app and add it onto the tablet. And then, like Peggy said, a good set of headphones that can connect to the tablet that the students can wear really makes a big difference in their ability to hear the sounds correctly and get a good idea of their hearing level. So
I do have one question regarding that, Matt. When you go into that hearing screening, it asks you if it's already paired up with a certain set of headphones that came with the box. And of course, mine don't. So I have to go through that calibration every single time to match it up with my earphones. Is there a set of headphones that are already paired up with the telebox?
No, there's not a specific set of headphones that are already paired with it. And I don't know, Macias, if you can speak to this as well, but I think it's probably good practice just to go through that calibration so that you're getting the best sound quality with whatever headphones you're using.
Yeah, absolutely. And again, one of those learning, things to maybe we need to get for some schools that use this, a good, headphones, just like the ones that you showed us, Peggy. So yeah, but yeah, it is recommended to do the calibration every time, even if we had provided you a, like good headset. So you have to do it, I think, anyway, because things changed and you want like the session to be as good as possible. So but I will look into some, maybe I don't know if you can share later. I will reach out to you one-on-one to see the headphones that you have. We have a few other headphones and brands that we like, and they are not expensive. So this is something that we can look and help you guys with some suggestions. But I'm thinking, Matt, more like for the future to have few of the kids with this, right? For some of the schools that will have this application too. So I think it's a good idea to look into that.
A lot of the schools already have noise canceling headphones for testing purposes. So if you ask your IT guy, which is what I did, he provided me with a set that they have for testing that's noise canceling. So they don't get all that outside interference. So, and there are lots of brands, and I did send the brand that I'm using at my school to Matt a while back. So he has that information, but it is important to have the noise canceling part on that.
Those of you that are school nurses that are on the call, do any of you have similar needs with hearing screenings? We did just want to clarify as well that the app and this workflow is not designed to, diagnose any type of hearing problem. It's really just a very basic screening assessment to evaluate their general hearing ability. But it's a great use case of, especially for the distance that you'd have to travel, Peggy, to get out there and be able to do these hearing screenings. To be able to do it remotely and use the telehealth kit is a great use case.
It's an amazing thing. And our district doesn't have audiometers, and we don't have a speech therapist that comes on a regular basis. So we don't have access to those things. Now we do. I'm able to bring my high school kids in and rescreen them, and kids love electronics and they love working on that. But I'm rescreening a number of high school students that failed the first time, and I'm rescreening them using the telehealth box. And they're very engaged in it. They want to do a good job and they want to do it right. So, I think it's been valuable. Our district is tiny. We don't have a lot of money. And so it's been something that's been of unbelievable value to us.
Yeah, that's good to know. I'd love to hear more as you do more of those rescreenings, to be able to compare their first results with the results from the telehealth kit. That'd be great to hear.
Okay, I'll let you know.
Hey, any other questions from anyone for Peggy? Maybe just in general, I'd love to hear how things are going. Has anybody done a telehealth visit recently or used the equipment, used any of the diagnostic equipment? Any stories anyone's willing to share? Okay, again, let us know if we can come do training. We're happy to visit school by school and look at the setup of your room, the equipment, help train secretaries, anything we can do to help improve the use of the equipment, but also the care of the students. That's our primary goal. We do have, just as another maybe last final update, we do have some requests into the legislature this year. UETN requested $50,000 of ongoing funding to continue to support the school-based telehealth program. So that will help us replace devices. It'll help us buy more of those otoscope caps that we've been promising to send out to you. And some other devices as well. 19 Labs continues to show us more devices. They have a really great general exam camera that can be used with the kits. There's some other equipment that we'd love to add to the kits as we go and make them more useful to you. So when the legislative session ends, hopefully we'll have an update. There's also a request for $4.5 million of additional funding for school districts that didn't get any of the telehealth equipment on the first round and want to participate in the program. So we're hopeful that that will get approved and we can continue to expand this program. Okay. Any final thoughts, questions from anybody?
Just want to say, Peggy, thanks so much for sharing. It's really just so helpful to hear that use case example and really comprehend the benefits that telehealth bring to students, children in rural areas, because that access piece is so hard, and school nurses are so in demand and hard to come by. So it's just great to hear that. So thank you.
Thank you.
Yep. Thanks for coming today and sharing, Peggy.
You're welcome.
We really appreciate you. All right. Well, we'll end a few minutes early. Thanks, everybody. And we will get this recording posted on that link if you want to share it with anybody who wasn't able to join today. Have a great weekend. Thanks, everyone.
Thanks for all you do.
Bye.